So good afternoon, one and all. Respected dignitaries, so I would like to congratulate first of all of you, the dignitaries, because you are the people who are responsible and the reason for giving the $1 million smile in any kid or a teenager. So please give a round of applause for all of you and thank you for being there. But if you find any flaw in that smile, then we are there to help. In today's world of social media, Instagram, YouTube, and camera, iPhone 17 has this feature and that feature. In that era, we are having a currency which is social currency, which is smile. In considering the overall health, what is our net worth, the social currency belongs to the smile as well. Because the teenager, that age group, is very sensitive on that topic and that concern. Is oral health affecting adolescents? Yes, because they are worried about their self-esteem. My friends will bully me, or friends will not accept me if I don't have, good set of teeth. So they have their random thought process. But nowadays they are demanding. They are checking their photographs and seeing, I'm not looking good because of that gap, overlapping tooth, or my bite is not well. And bad smell and other things are also affecting their friendships. The discoloration of teeth is also like the cause of bullying. Pain and discomfort is affecting their academics. And of course the confidence. If they don't have good smile, they don't have good confidence. And if they have good smile, interview them. They'll see a beautiful confidence after they have got their teeth corrected or smile corrected. Pediatric dentist, like we start with newborns, like natal, neonatal teeth we remove, then we replace it after 18 years if they don't have consequent, like the subsequent tooth. Cleft lip and palate, we just give obturator feeding plate the surgical age. Then the corrective, the jaw correction and the teeth correction happens after adolescent age. Tongue tie, lip tie, if not corrected early, they'll also cause speech problems, as well as they'll have malocclusion. The alignment also goes on toss if they are not corrected in time. Early childhood dental caries. If the milk tooth has a cavity, it has root which is having a permanent tooth which is coming from beneath. If there is an infection in the milk tooth, that will also cause damage to the permanent tooth, because this infection, the pus discharge, will be having a localized effect on the permanent tooth bud, which will be causing the hypoplasia. The enamel will be weak for the life. Even the trauma case, if they have injury, they don't have any signs and symptoms, but it is discolored, then it goes into necrosis, the pulp tissue, that will cause abscess. That bacterium and abscess will cause permanent damage to the permanent tooth bud. Habit intervention, if it is not done early, like first year is okay, but after that, if they continue with thumb sucking, the proclination of upper teeth, retroclination of the lower lip because of lower teeth because of the lip biting habit, tongue thrusting, that will cause open bite. If you have seen 21 trisomy cases, but overall, many of the cases which don't have any abnormality, but they have tongue thrusting habit, that will also cause abnormal movement. Mouth breathing is great consequence. Mouth breathing has tongue posture which is coming down. It is not on the palate, so the palate goes narrow. The narrow upper jaw, malalignment, and the lower jaw is also retruded, long face syndrome. So there is a whole of consequence because of these habits. Bruxism will wear off all the enamel. Alignment intervention, if they have underdeveloped or narrow jaw or retruded mandible or reverse mandible, then we can correct it between 8 to almost 12, 13, 14 till they finish their complete growth. Till then we can modify that. If it is narrow, we can expand it. Reverse, we can reverse it. So those kind of things can be done. Why we are talking about this is because if they are dealt early, then the adolescent period will be comfortable with that alignment and that proper function. So stitch in time saves 9. So as we are heading towards Navratri, yeah, so it's all connected. Like Navratri is connected to this video, and of course, if we are not treating the kids, then adolescent is connected, and then we are going to face those problems in future. But when they are turning adolescent, we are also dealing with growth, the hormone changes, and the lifestyle. They are eating junk food, late night sleep, while watching mobile, they're pocketing the food and everything. So those things are consequent. So they are also going to damage the oral health. I just wanted to request the dignitaries to just take out 1 minute and do E and check their front teeth, and do A and check their upper and lower back teeth. Okay, just small request. That will include 1 minute of examination. What do you have to see? Just smaller things. If they have black, brown spots or holes in the teeth, they are dental cavities. If they have red gums or swollen gums, gum diseases. If they have some malalignment issue, the teeth are not in proper shape, or jaw is not in proper shape, or if you see any injury like the tooth is fractured or tooth is black discolored, that shows necrosis of the pulp, or any injury which is affecting the upper and lower jaw or discrepancy. Then halitosis. If they complain of halitosis, or if you feel that there is a halitosis, you can ask that, if you are facing this regularly, because halitosis can be masked with mouthwash. But if you don't clean it, or if you don't touch the root cause, then it's not going to work. Tobacco consumption, if you see Zuma Kesri, then you can ask them to visit us. You can clean it, and then basically, we can help them with counseling as well as getting rid of the habit. Wisdom tooth. Many of the teenagers get wisdom teeth between 16, 17. They get started with the tooth bird. They have pain which is lingering from the lower jaw, the whole jaw. They have pressure pain that lingers to ear, headache, and even the upper back. So that can trigger this kind of pain. If that is symptomatic, then there is a chance, and that age there is a problem with wisdom tooth. Dental cavities, gum problem, trauma, and habits. These are the diseases which can be prevented. We can give them sealants to prevent dental caries. Gum problem, we can prevent it with regular cleanups. Trauma, we can ask them to wear sports guard to, in aggressive sports, they can wear it and play. Habits like thumb sucking, lip biting, mouth breathing, teeth grinding. Every habit can be corrected and intervened with specialized appliance, which is given for 1 to 2 months. Thumb sucking, lip biting, there are lip bumpers, thumb sucking appliances, and mouth breathing over plates, which can help them to get rid of the habits. So you are the first line of defense, because red flag for these causes can be raised by the pediatrician so that they understand and get intervened for the same. So you can clear the doubts, create awareness, create prevention also for them. Prevention in dentistry is only possible, so we can create that awareness. Clarify the stigma of not going to the dentist. They feel proud. आज तक कभी भी dentist के पास नहीं गए. That is the stigma, but overall that is not good. You should get the checkup done until and unless you get the major problem, you don't visit, or pain, or just hidden stress of ulcer and cancer. You don't visit the dentist. It's not good. So regular checkups are important. And bad habit prevention, like even the tobacco and other side of hookah, vape and all, and the habit like which are deteriorating the jaw structure. We also have now anxiety-free possibility that laughing gas facility is there. Laughing gas and oxygen, there is a specialized machine which gives you a comfort zone. You are on a cloud 9 and you are very much comfortable. Even with the prick of injection, even the tooth removal is comfortable. And they are like, after the reversal, we give 100% oxygen and they walk down from the office. So there is no dizziness or anything. It's 100% reversible. It's not IV. It's just a nasal this thing. And in case of physical, mental, or medically challenged children or adolescent, or maybe a grown-up kid who are like having previous trauma from dental offices, there we have to treat it under general anesthesia, wherein we do all the treatments under one go. So every child and teen has fundamental right to have the best of the health, including the oral health. But we are talking about now the best of the alignment possibility, which is the latest in dentistry. Braces and like metal braces, the white ceramic braces were there, which every month you have to go for the wire change and align the teeth. But now we have this. These are called aligners. So basically, yeah, so these are invisible thermoplastic trays which will help you to get the teeth aligned. Every week you change it and your bite from here to here it will be corrected. So these are the transparent plates and that works very well. It's not just a cosmetic product, it's not just a health service. If the teeth are reverse bite, it will wear off the enamel. If they are forwardly placed, it will cause jaw problem, TMJ problem and muscular problem. If they have deep bite, they will wear off the enamel. If they have something abnormal like zigzag teeth, they are not aligned, they will have cavities and gum issues. So it's not just the cosmetic. Cosmetology is a byproduct. After we are cleaning or aligning the teeth, you'll be the child, like the person will be able to brush well and keep the hygiene very well. So that is why alignment is important. So this kind of gap teeth can be corrected within few months with aligners or braces. Even the bite issues like this can be resolved very well. Underbite, oh sorry, even the reverse bite, overbite, forwardly placed teeth, and crowded teeth. If you have seen any, so E and R, when you see these kind of conditions, you can refer them to the pediatric dentist so that they can help. So this is some small case. If you can see, this is an overeaten milk tooth which got corrected. We removed it. You can see malalignment here in the lower arch. If you can see, this was now round arch, completely aligned teeth. Even this alignment is now within 20 aligners, 20 weeks. This can be achieved very well. Then they have to wear retainers. This case, he has got a deep bite. Can you see? The upper teeth are completely covering the lower teeth. That is called deep bite. So this will damage the lower teeth, then like lower back teeth are treated. So we are just correcting it. 26 aligners will get this result, and then we'll be going for the cosmetic treatment because he has got fluorosis. Audio knee. Super good. Chal se. Chalo. Okay, fine. So there's a volume lag. I'll just skip the video because so this is the QR code which will give you exact idea about before and after smile before the treatment gets started. After the scan is done, we do primary checkup. When we do proper scan, this is an oral scanner which will give us a 3D image of that this thing, the mouth, the teeth, and we print it, like the company prints it and then manufactures the aligners. So they are uploaded in software, and this kind of transparent plates only will help in alignment of teeth. So no more pricking of bracket and braces and wires. Now it is just easy like this, and convenient for the patients. So it's the bridge between the pediatricians and the pediatric dentists, which can be dealt with, which can help the adolescents to get the best of their smiles. So this is my Instagram page. If you could just follow me, it's Friend Dentist. And if you want to see your smile, click on this, take out your cameras, click on the link, then smile in front of you, like the front of the camera, smile big, E, and follow the instructions. You can put in details, and that will give you then the center line. You can just move it left and right, you will see before after smiles. Thank you so much for your time. Thank you. Thank you, sir.